Hello everyone and welcome back to the channel. If you've recently been diagnosed with osteoporosis, you've probably asked yourself one very important question. Can it actually be reversed? Can you rebuild bone that's already been lost? Can you improve your bone density? Or is osteoporosis something you simply have to live with for the rest of your life? These are some of the most common questions I hear in clinic, and unfortunately there is a huge amount of misinformation online. Some websites claim osteoporosis can be completely reversed naturally, while others suggest that once you've lost bone, there's nothing you can do. The truth lies somewhere in the middle. The good news is that osteoporosis is one of the few chronic conditions where we can often make a significant difference. We now have treatments that not only reduce the risk of fractures, but in some patients can actually increase bone density and strengthen the skeleton. However, it's important to understand what we really mean when we talk about reversing osteoporosis. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology London, and in this video I'm going to explain whether osteoporosis can truly be reversed, how bones naturally repair themselves, what treatments are available, and the lifestyle changes that can genuinely improve your bone health. Let's begin by understanding what osteoporosis actually is. Many people imagine that bones are solid structures that never change, but that's simply not true. Your skeleton is constantly renewing itself throughout your life. Old bone is continuously being broken down and replaced with a new bone in a process known as bone remodeling. Think of your skeleton as a building that is permanently under renovation. Every single day, old bone is removed and new bone is laid down. In healthy adults, these two processes remain in balance, so overall bone strength is maintained. The problem begins when that balance changes. As we get older, particularly after the menopause in women, the cells that remove bone become more active than the cells that build bone. Gradually, the tiny microscopic holes within the bone become larger, the structure becomes weaker, and the bones become more fragile. That's what osteoporosis really is, not empty bones, but bones that have become thinner and less able to withstand everyday forces. So can this process be reversed? The answer depends on what we mean by the word reversed. If by reversal we mean returning your bones to exactly the same condition they were in when you were 20 years old, then unfortunately the answer is generally no. We cannot completely reset the aging process. However, if we mean increasing bone density, strengthening bone structure, reducing fracture risk, and in some cases moving someone out of the osteoporosis range on the DEXA scan, then the answer is yes. For many patients, we can absolutely improve bone health. In fact, one of the biggest misconceptions about osteoporosis is that nothing can be done. I often see patients who are frightened after receiving their DEXA scan results. They assume that their bones will simply continue getting weaker year after year. Fortunately, that's not what usually happens. Modern osteoporosis treatment has advanced enormously over the last decade. We now have medications that not only slow bone loss, but can actively stimulate the formation of new bone. Combined with the right nutrition, exercise, and lifestyle changes, many patients experience meaningful improvements in bone density and, more importantly, a significant reduction in fracture risk. It's worth remembering that our primary goal isn't simply to improve a number on a scan. The real aim is to prevent fractures. A stronger DEXA score is encouraging, but what really matters is helping you avoid broken hips, spinal fractures, and other injuries that can affect independence and quality of life. One of the most important factors is exercise. Many people worry that if they have osteoporosis, they should avoid activity because they're afraid of breaking a bone. In reality, the opposite is often true. Bones respond to mechanical stress. When muscles pull on bones during weight-bearing exercise or resistance training, the skeleton receives signals that encourage it to maintain or increase its strength. Walking is an excellent place to start. Resistance exercises using weights or resistance bands can also be extremely beneficial. Balance training such as Tai Chi, yoga, or Pilates may reduce the risk of falls, which is just as important as improving bone density itself. Of course, any exercise program should be appropriate for your individual health, particularly if you've already experienced fractures, but remaining active is one of the best things you can do for your skeleton. Nutrition is another essential part of the picture. Bones require the right building materials. Calcium is one of those materials, but it's only one part of the story. Vitamin D is equally important because it allows your body to absorb calcium effectively. Many people focus solely on calcium supplements, but if you're deficient in vitamin D, your body can't use calcium efficiently. This is why your doctor may recommend checking your vitamin D levels and treating any deficiency before or during osteoporosis treatment. Protein also deserves much more attention than it often receives. Bone isn't made purely of minerals. It also contains a protein framework that gives it flexibility and strength. Older adults frequently don't consume enough protein, which can contribute to muscle weakness as well as poorer bone health. Lifestyle factors also matter. Smoking accelerates bone loss, while excessive alcohol intake increases fracture risk. Maintaining a healthy body weight, staying physically active, and preventing falls all contribute to protecting your skeleton. Now let's talk about medications, because this is where things become particularly interesting. Some osteoporosis medications mainly slow the cells that break down bone. Others actively stimulate the cells that build new bone. Understanding the difference is important. Alendronic acid, risedronate, zoledronic acid, and denosumab primarily work by slowing bone breakdown. They allow your body's natural bone-building cells to catch up, resulting in gradual improvements in bone density over time. Evenity, or romosozumab, which I discussed in another video, works differently. It actually stimulates new bone formation while also reducing bone breakdown. This dual action makes it one of the most exciting developments in osteoporosis treatment. Teriparatide is another medication that actively builds new bone and is particularly useful in selected patients with severe osteoporosis. Do these treatments work? The answer is yes. Clinical trials have consistently shown that these medications increase bone density and, more importantly, significantly reduce the risk of fractures. That's why they have transformed osteoporosis care over the past 2 decades. One question patients often ask me is how long it takes to see improvement. Unfortunately, bone is slow to change. Unlike prednisolone, which may improve symptoms within days, osteoporosis treatment works over months and years. DEXA scans are usually repeated after 2 or 3 years because meaningful changes in bone density take time. Patience is important. Another common misconception is that once your DEXA scan improves, treatment can simply stop. In many cases, the gains we've made need to be maintained. Some medications are followed by others to preserve the new bone that's been built. Osteoporosis management is often a long-term strategy rather than a short-term fix. It's also important to remember that bone density is only one part of fracture risk. Muscle strength, balance, eyesight, medications, home hazards, and overall health all influence whether someone is likely to fall and sustain a fracture. This is why treating osteoporosis isn't just about tablets or injections. It's about taking a holistic approach to bone health. So can osteoporosis be reversed naturally? Lifestyle changes alone may produce modest improvements, particularly in people with osteopenia or very early bone loss. Exercise, adequate calcium, vitamin D, good nutrition, and avoid smoking all play important roles. However, for patients with established osteoporosis, lifestyle measures alone are usually not enough to reduce fracture risk significantly. That's where medications make such a difference. Modern treatments can dramatically reduce the risk of fractures and in many cases improve bone density beyond what lifestyle changes alone could achieve. The key message I want you to take away today is that osteoporosis is not a hopeless diagnosis. Being told you have osteoporosis does not mean that fractures are inevitable. It doesn't mean your bones will simply continue getting weaker every year. There is a great deal that can be done. We can improve bone density, strengthen the skeleton, reduce fracture risk, and help people remain active and independent for many years. The earlier osteoporosis is identified, the better. That's why DEXA scanning, fracture risk assessment, and appropriate treatment are so important. Waiting until after multiple fractures have occurred is something we always try to avoid. If you've recently been diagnosed with osteoporosis, don't panic. Speak to your doctor about your individual fracture risk. Make sure your vitamin D is adequate. Stay physically active. Eat a balanced diet with sufficient calcium and protein. Avoid smoking. Limit alcohol, and if medication is recommended, understand why it has been suggested and how it can help you. The goal isn't simply to improve a scan result. The goal is to keep you walking, keep you independent, and keep you doing the things you enjoy for as long as possible. I hope this video has helped answer one of the most common questions I hear in clinic: can osteoporosis be reversed? The answer is that whilst we cannot turn the clock back completely, we can often strengthen bones, improve bone density, and dramatically reduce the risk of fractures with the right combination of treatment and lifestyle changes. If you found this video helpful, please like, subscribe, and share it with anyone who may benefit. For more videos on osteoporosis, arthritis, autoimmune disease, and rheumatology, don't forget to subscribe to the channel. And if you would like a specialist consultation, I see patients at Pure Rheumatology London. Thank you very much for watching.